go back to vaccination and COVID-19. The race is on to inoculate health workers before the Sisonke Trial period ends, and it's leading to scenes of long queues. We've seen it throughout this week. The health department is calling for calm, though. Even though the Sisonke campaign is ending, government's phase 2 of the rollout, targeting those over 60, will begin on Monday. Here's my colleague Heidi Jokos at a vaccination centre this morning. I understand you're at Charlotte Maxeke Hospital in Johannesburg. Good morning to you, Heidi. How does it look this morning where you are?
Well, we were here yesterday, Gareth, where the queues were extremely long, the day before as well, basically the whole week, given the fact that the Sisonke trial is ending tomorrow and there is pressure to get as many healthcare workers and support staff inoculated as quickly as possible before that Sisonke trial ends. But we do understand that the Department of Health here in the province indicating to those who have not yet been inoculated to not panic and to remain calm, as they will still be able to get vaccinated as of Monday when phase 2 kicks in. We know phase 1B will still be rolled out as of Monday, so the two phases will most likely overlap. But we are at Charlotte Maxeke, which is one of the vaccination centres here in Johannesburg, where you can see there are still a number of people. The queue stems all the way back. Unfortunately, it's a little bit difficult to show you with all the cars that have parked on the side, but a number of healthcare worker support staff have queued here. We do know, according to Sisonke, that they are no longer going to be accepting walk-ins. Previously, they sent out a notice on Monday to say that they are calling on all healthcare workers and support staff that have not been vaccinated to get to their nearest vaccination centre. They will be provided with a voucher if they do not have one. But because of what we've been seeing over the past couple of days with the influx of people coming in and concerns that there are just too many people in the queues and at vaccination centres, they sent out a notice to say only those with vouchers will be assisted. So there seems to be some kind of order. Still a very long queue, but of course I think they're just trying to manage it as the time is running out for Sisonke to end as of tomorrow, and they still have a number of vaccines to distribute with regards to the Sisonke trial.
And Heidi, and I know that there are queues there and those arriving have got vouchers, but I know you and me and many other people who've been out in the field covering this, I'm sure we'll be able to notice again, I certainly am, there's very little social distancing. Ironically, these are health workers. And while there seems to be no panic per se, very little social distancing, I know this is a question that you asked earlier in the week, what this is going to look like come Monday when those over 60 are going to be allowed to come through for their vaccinations. There is some concern about what that's going to look like, isn't there?
Yes, certainly, Gareth. If this looks like this right now, and this week we have been seeing so many people come through, what is phase 2 going to look like? What picture will we be seeing come Monday when those 60 and above are queuing up to get their vaccines? So it is, of course, some kind of concern with regards to what that is going to look like. But also the other concern, Gareth, is the fact that those that have registered that are 60 and above, that were told to register about 2 weeks ago. Nationally, we know it's about just under 500,000 that have registered. We, of course, need to double-check that number from the electronic vaccine data system that allows for those to register. But those who have registered have not yet received an SMS to indicate their voucher number, if they're supposed to get a voucher number, the date and time as to which vaccination centre they need to be at come Monday when phase 2 kicks off. So hopefully the Department of Health is working on that to make sure that those who are supposed to be queuing on Monday know exactly where to go. So to speak to your point, if there is not a lot of social distancing this week with healthcare workers and support staff queuing and panicking to get that jab before Sisonke ends, what will happen come Monday? So hopefully there will be better measures, especially for the elderly, the vulnerable, and those that are frail. If you look at parents, grandparents, and so forth, some of them will not be able to stand in a queue for 10 hours to get that jab. So we'll just have to put pressure on government to provide clarity as how Monday is going to unfold.
Well, I just had a chance, Heidi, to speak to the Health Minister just a few minutes ago. I think you were getting ready for our live crossing, and I put that question to him about the SMS problem and those who haven't received SMSs, even though they registered weeks ago. And his call for viewers who may have missed that: if you've not received the SMSs yet, do not go to the vaccination sites on Monday. It is obviously a technical issue somewhere, very large numbers, but only if you have an SMS are you being asked to go through. As far as elderly people are concerned, the Minister telling me that they understand, of course, that very old people may need a family member with them, and they understand that. But, of course, again, Heidi asking for that social distancing. But Monday, I think, is going to be very interesting, as we've never had to do this before as a country. But for the moment, Heidi Jokos, I'll come back to you again a little bit later. Calmer scenes.